Well, at the Athens Nurses Clinic, we really enjoyed working with our medical students, and our patient population really enjoyed because they had a fresh set of eyes and ears to talk to, especially in the smoking cessation classes. It was really good for the students because we have here at the clinic a patient population they may not have an opportunity to run into. We have a population of multi-generational poverty, as well as those newly impoverished. We have a high percent of homeless, or what we call imminently homeless, which means they could within 24 hours lose the place they're staying. And when you are middle class or upper middle class, you may not have ever met someone who could pack up all of their possessions and be gone in 4 hours, or someone who was from a household where they not only can't think about where they're going to go shopping, they have to worry about, is there going to be enough food that night for dinner? So we have a population at the clinic of patients who are indigent, who are sometimes homeless, sometimes they're living with family members. They are an average, maybe 9th grade education. They avoid being tested for certain disease processes because they don't want to know the outcome. When they do come in and they're discussing their problems, they use some terminology which may be either very Southern or just part of the street culture in which the patients come. An example was the patient who came in because he was frequently getting dizzy and weak, and we checked him out and his blood sugar was extremely elevated. It turned out he had diabetes. And the medical student said, well, how long have you had diabetes? And he said, I ain't got diabetes, I got the sugar. And so there's a misunderstanding, and by working in this patient population and being able to listen to what they say and absorb it and interpret it, it really helps the medical students, I believe, learn as much from our patients as our patients were able to learn from them, which made it a great experience for all of us.